coarctation of the aorta. What is it? Coarctation of the aorta is a congenital narrowing in the proximal descending thoracic aorta, most often located just upstream from the entry site of the ductus arteriosus. And here's the ductus arteriosus, and here's the coarctation. My patient is Harry Potter. He's 30 years old. He's a male. He had leg pain, and he had dyspnea on exertion, which is just sensation of running out of air and not being able to breathe during physical activity. And then he had an 8-year history of hypertension. On his physical examination, he had a temperature of 98.9. His pulse was 88, so both those were normal. His blood pressure was hypertension, 168/92. And then his respiration rate was 20 breaths per minute, which is normal. Then he had an S4 gallop, which occurs during active LV filling when the atrial contraction forces blood into a non-compliant LV, usually a sign of diastolic heart failure. And then he had a systolic murmur heard along the left heart border. And then peripheral pulses, femoral pulses, are +1 bilaterally and delayed when compared with radial pulses. And just the +1 that, okay. The +1 is just a scale. There's a scale from 0 or from 1 to 4 on the intensity of what's heard. And a +1 means it was just barely detectable. And then you can barely hear it, but that's what a gallop sounds like. And then the laboratory findings on the echo, he had moderate to severe left ventricular hypertrophy. He had normal systolic function. He had diastolic dysfunction type 2, which is increased stiffness to the LV and elevated left atrial pressure. He had suprasternal windows showed narrowing with the lumen of the thoracic aorta. The color Doppler showed turbulence in the arch. Severity was determined by max flow across narrowed area and calculate the pressure gradient. This patient was 56 millimeters of mercury, and anything over 20 is considered for surgery. Patient also had bicuspid aortic valve. On the EKG, he had normal sinus rhythm with evidence of left ventricular hypertrophy. On the X-ray, he had rib notching, which is just a radiological sign where the surface of the ribs are deformed. He had normal cardio-pericardial silhouette, normal lung fields. In the aortogram, after contrast was inserted into the root, it marked focal narrowing of the descending thoracic aorta. Angiogram, coarctation of the aorta distal to the left subclavian, and on the MRI just showed the coarctation. Here's pictures of the M mode, and then this is the gradient. This is the coarctation.
Okay, Mom cleaned up my mess.
On the discussion, in a patient with coarctation of the aorta, they normally have carotid and upper extremity pulses are usually normal to slightly enhanced. The femoral pulse is determined and delayed compared to radial pulse. The lower extremity blood pressure will normally be higher than the higher extremities. Coarctation can occur at any level of the aorta, but 95% of the cases have been located left subclavian artery near the ligamentum arteriosum. A bicuspid aorta valve is found 40 to 80% of patients with isolated coarctation of the aorta post-ductal type. Coarctation is the most common cardiac anomaly associated with Turner syndrome. And Turner syndrome is just a chromosomal disorder in which a female is born with only one chromosome. And the most common non-cardiac abnormality associated with coarctation is intracerebral aneurysm, which is a brain aneurysm. And then the facts about coarctation of the aorta, unless it's very severe, patients are usually asymptomatic until mid-teens, and even then, is usually diagnosed by finding hypertension or having an abnormal X-ray. These patients have higher risk of developing infective carditis. Severe obstruction of blood flow causing the aortic branches are confused by collateral channels from the axillary and internal thoracic arteries through the intercostal arteries. Causes increased overload, which leads to left ventricular hypertrophy and eventually congestive heart failure. Proximal hypertension can lead to early cardiovascular disease if uncorrected. The treatment includes surgery is recommended to remedy hypertension and prevent complications. The optimal time for surgery is between ages 2 and 6 years old. If the surgery is delayed, some patients will remain hypertensive despite successful surgery to correct the coarctation. Other treatments include intraventricular balloon dilation via femoral artery, catheterization, or have an endocardial repair. Treatment indications include decrease in lumen diameter by 50% at the site of coarctation and a gradient of more than 20 millimeters of mercury across the lesion. And this is the balloon. They just blow it up to make the coarctation back to normal size. And this is another patch. This is the endocardial patch. Those are my references. Okay, this is the TTE, the suprasternal view. It shows a discrete area of narrowing with the lumen of the thoracic aorta. Color Doppler image shows turbulence in that arch due to coarctation. There's the turbulence. And this is the angiogram that I was talking about. And this is the bicuspid aortic valve.